Hello, my name is Sumayah Ansari, and I'm one of the creators of this disease project. The disease that we chose for this project is chickenpox. The background behind chickenpox. How is it caused or how was it created? In the article Varicella, it says that in 1875, Rudolf Steiner demonstrated that chickenpox was caused by an infectious agent by inoculating volunteers with the vesicular fluid from a patient with acute varicella. Who created it? There isn't a specific creator of this disease since many people have looked into it. It is said that in 1875, Rudolf Steiner showed that chickenpox was caused by an infectious agent, while von Bouquet made the first clinical observation by distinguishing the herpes zoster from Varicella zoster in 1909. Lastly, Thomas Weller was the person who had actually isolated the Varicella virus in 1954. So where did it come from? A lot of people believe that chickenpox came from Africa, but there isn't much evidence to back up that claim. Most people think that chickenpox came from Europe in the 17th century and say that it has even been traced back there. Why was chickenpox discovered? Chickenpox was discovered to find out what was causing these random red spots and rashes on humans that would itch and how to get rid of them.
The causative agent and microbes of chickenpox is the primary varicella zoster virus, and shingles is the secondary, known as herpes zoster virus. This organism is a member of the human herpesvirus subfamily Alpha herpesviridae, which is a DNA virus. In 2 weeks, the infection confines in the skin cells, causing vesicles, which are liquid-filled blisters, to appear on the body. Vesicles let out chemicals in the skin that activates the nerve that causes it to itch. The latent disease moves to the spine near the dorsal root ganglion due to the virus entering the nerves and remaining dormant. The most common bacterial skin and soft tissue infection from chickenpox is during 3 to 4 days when the infected skin is vesicular, causing the vesicles to fill with pus, rupturing, and then before healing, it forms a scab. However, over time, the inactive virus becomes reactive active virus as an adult, which forms shingles. The microvesicular and herpes zoster virus is a gram-positive organism that appears in purple and circular, with arrangement of cocci such as Staphylococcus aureus, circular clusters, and group A beta hemolytic streptococci circular chains.
The symptoms of this disease. The main symptoms for chickenpox is a skin rash that's raised and over time gets very itchy and then would eventually look like a small blister. Doctors call these papules. Another symptom is fever, loss of appetite, headache, itching, or sore throats. Diagnosis and treatment. It is said that chickenpox is usually diagnosed depending on the type of rash the patient has. Is the rash small? Is it big? They have different treatments for the sizes or even depending on the color of the rash. When you have chickenpox, the best thing to do to treat it is to use medication that your doctor has prescribed to you. You can also take pain reliever pills or even rub some lotion that helps with the chickenpox blisters, such as calamine lotion. To even avoid having chickenpox, you can take the chickenpox vaccine. How is chickenpox contracted? Chickenpox is usually contracted by another person who has chickenpox. This is a person-to-person disease. The blood test of the disease is the whole infected cell ELISA. This is most commonly used to determine if a person has antibodies to VSV from past varicella disease. Another test used to diagnose the disease is the polymerase chain reaction. This detects VSV in skin lesions. Medically, chickenpox is treated using an antiviral medication such as aquilover or vaculover.
Incident and population affected by chickenpox. Varicella zoster virus occur worldwide. Every year it affects 4 million people. One person can affect 90% of people around them. Chickenpox is not biased of age, race, sex, nor health. Older adults, immunocompromised, and pregnant women have a high incidence of complications from this disease. More than 95% of American adults have been affected by chickenpox, but it's primarily a childhood disease that affects most children by the age of 10. Today, varicella is mild in children since the chickenpox vaccination was introduced in 1995, which has prevented and decreased complications and death by over 90% in the U.S. However, shingles are rare in children but affect mostly adults over the age of 50 and is less prone to develop in men than women.
The prognosis of chickenpox is generally good in both children and adults. However, it can become deadly, especially in those who have a weakened immune system. With more severe cases, complications such as bacterial infection of the skin, bone, and blood, inflammation of the brain, and toxic shock syndrome can occur. Most people are immune to chickenpox after they have it, and the virus lays dormant in the body and can later resurface as shingles. The current research is the information that has been mentioned previously in our presentation, such as who is most susceptible and what the disease looks like. Recently, at Stanford University, they have found that the protein in the virus that initiates infection does not operate how they thought. It turns out that the fusion fingers, what they call it, is what they thought binded to the host cell, which causes the infection. However, there may be more to the fusion process than we thought, because it turns out that's not really what the virus uses to bind. Future research, the research that's been done has discovered great details about the virus. However, there's always more questions to be answered. Group opinions. Chickenpox was once a heavily feared disease and it wiped out thousands. Now that we have the research, knowledge, and resources to study the disease, it's very important to learn about the disease. Chickenpox is a unique and interesting disease. However, there is no exact cure, and it's incredible that these red spots can show up on our body, causing rashes and itching that last for about 1 to 2 weeks.